Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where you guys ask questions about getting into dental school, getting into residency, coming to America to be a licensed and practice as a licensed dentist in the U.S. Those are the questions you ask. This is the information that we guys help you guys with. Be sure to check my YouTube channel every day, right here. Dr. Darwin Speaks, but you can send me questions that you guys may have right here at newdentistcoach@gmail.com. Newdentistcoach@gmail.com. And also YouTube, please check my channels, share, make comments. Your feedback is what allows us to help you and also other people. The other people that we're talking about actually is we have on the line today. We're going to be talking to him. This is part 3 or 4, helping him get into residency. And this series is called Getting Into Residency. We're actually, this is part of my coaching series, Smiles to Success Coaching. If you too want to be coached, again, send me an email at newdentistcoach@gmail.com. Tell me what's been bothering you, what you're fearful of, what's been holding you back, or what things you're having challenges, or what things are also difficult for you. And then we can get you set up with some coaching. So today we're going to be talking more about working on a CV and drafting up your CV. We've got student Dr. Mubarak, who's a 4th-year dental student in Canada. Hey, Doc, how you doing? Good to see you again.
It's good to see you too. I'm doing good. How are you?
Good. I know you're preparing for some practicals and preparing for the CDCA, right?
Yep. We had the CDCA mannequin competency next week.
Wow. Well, good luck to that. Good luck on that coming up. And at the same time, you're multitasking, trying to get your CV and your application together for residency as well, right?
Yep.
So last time we talked, we were working on your CV, and you had sent me a draft, and we wanted you. I wanted you to kind of move some things around. We're actually going to share it. Let's take a look at it and let's share it so that people can kind of see, if you don't mind. People can kind of see, and you can see what we're working off of as of right now. So can you see it?
Yep.
Okay, perfect. So one of the things that we talked about that we wanted you to do is to have some more a better format, so that when someone's looking at it, it reads it has a format that reads consistently and that things that stand out. All right. So looks like most of the things that you have here in red are some of the things that we talked about as far as grouping them into certain segments.
Yes. So that's like the thing that that's how I changed them. That's off the comments from the last video call.
Right. So good. You've got your name kind of centered in the CV. You've got your address there. Main thing is your telephone number and your email address. I would even make that a little bit bigger, your address at the bottom there, because the main way people are going to get in contact with you regarding interviews will be your telephone number and then your email address. So I would make sure that line underneath your name is centered. Put it in the center like your name, so it spreads out all across that line, and maybe change the font, make it a little bit bigger.
Cool.
All right. Professional summary. Just make sure that reads professional. Take that S out after the L. And professional summary. You basically want to state your goal. Why, what's your goal that you're looking to, or target that you're looking to attain? So for you, for residency right now, for the GPR program, it would be along the lines of to gain admittance into a GPR program so that I can expand X, Y, and Z, do this, train, increase my confidence, my speed, in addition to, contributing to the mission of the program, something similar to that.
Yeah.
Okay. Awesome. Education. So yes, this is where we start getting into the meat of the CV. So You've created that education section, which is great. I would tell you for all of these sections, like education, work and organization, what else? Volunteer, all those areas that you have in red, I would make them, not only would I make them bold, but I would make them capitalized. And that's, again, this is just my preference. Capitalized, and even I would even underline them. Let's see what that looks like. So capitalized and underlined.
Okay.
And I'm not sure what font you're using. It may be an 8 or a 10.
A 10, yeah.
10, yeah. I would make it either a 12 or a 14.
Cool.
All across, 12 or 14. So education, yes, Dr. Dental Surgery. Student, year 4, Dalhousie University. That looks fine. GPA 3.3. Are you on the dean? You're on the dean list, right? Right now, dental school.
No.
Okay. Do you know your rank?
Nope.
Nope.
Yeah.
When do you guys get your rank?
I think it's by the end of the year. I will ask them. So I have an appointment next week to ask for my dean's letter. Okay.
Yep. Are you doing any special internships, like clerkships? Like, are you? I know at some schools they have these opportunities for D3 or D4 students to do a special rotation in oral surgery or a special rotation in ortho.
Yeah, I'm doing it.
All right, so you need to put that underneath DDS.
Okay, because I wasn't sure like where to add them, so I added them all the way at the bottom.
No, it's too far down. We don't want to see.
I added them to IWK and Victoria General Hospital.
No, too far down. Let's put them up higher so people can see them.
Okay.
Right? Got to keep in mind, when you're doing this CV and people are looking at them, it's quick. Yes. I mean, it's less than 5 minutes. So you want the most important stuff to stand out first. When you first have our attention, when we're looking at your CV, we want to see the stuff all the way up here, up front. So right under your DDS and your GPA, I would put down whatever clerkships or internships that you're doing. So you have one for oral surgery?
Yes, I have. I did one in third year, and I'm doing one next week in November for 2 weeks.
Yeah. Good. So those need to go right underneath your DDS stuff.
Okay.
All right. I would put the one that you're getting ready to do now for 4th year. Put the dates, November. How long is it going to be for?
2 weeks.
2 weeks. So good. So I would put the dates that it's going to be, right, for your D4 year. And then also the one that you did your D3 year, right underneath it, I would put the D3 year externship, whatever you did. Right down. I don't know if can you see my cursor at all?
Yes.
No.
Yes, I do.
So right here, under DDS 3 term, you're going to put your D4 externship right underneath here. And then you can put your dates, November 2018, and briefly describe what it is. And then underneath there, put your D3 one as well.
Yes.
Put the dates and then a bullet point on what it is, what you did.
Yeah, and in D3 I did also a pediatric externship too.
There you go, man. So you got 2 of them for D3 year.
Yes.
That's perfect. We want to see those. We want to show those, highlight those, because they are areas of interest, but is also showing areas of interest, but then also showing that that you've been selected for those, because I'm pretty sure not everyone in the in your class gets exposure to it, correct?
Yeah.
Everyone doesn't get selected for it, right?
Yeah.
Yeah, so that's why it's key that we show those, okay? Also, it's a good topic of conversation when you go into your interview, you know, especially when you start talking, if someone starts asking you about, you know, after your residency, what are your plans? And then you can talk about the oral surgery piece. You could talk about ortho and how you have interest in those areas and how that interest even started, you know, in dental school, and you've had a chance to be selected for a couple of internships or externships within the school, clerkships within the school, to explore that interest even more.
Yeah.
So that's why you want to put that on there.
Cool. I'll change that.
Also, I'm looking at the next one, which is your Bachelor of Science. That looks fine. Yep, GPA. Now, is that a GPA 4.3 out of 4 or out of 5 or out of different?
Out of 4.3.
4.3 out of what?
4.3.
So 4.3 is the highest?
Yes.
Or is 4.0 the highest and you just got a 4.3?
No, 4.3 is the highest.
Okay. Okay, gotcha. Because that might be something somebody might want to ask.
Yeah.
What I would do is flip on your things for education. Put your university first.
Okay.
Put your university first. Then you can put your Bachelor of Science, and then you can put your date.
Okay.
So basically, all you're really doing is flipping it out. For DALUHOS, for your DDS, just make sure you put your the date that you started. So for you, you'd be 2015 to 2015 present.
Okay.
All right. Any other educational stuff? Did you do? Looks like there's a year between finishing your undergrad and then going into dental school. What'd you do?
No, I got in straight away after undergrad.
All right. So undergrad says 2011 to 2014.
Yes, and I got in 2014 to 2019.
Oh, so it's a 5-year program?
4 years.
Well,
yeah, I think it might be I have to change it.
Yeah.
Yeah. Because I got into straight after my undergrad.
Okay, I see. I'm sorry. I see what you're saying. So you graduated in May 2015. Right. I got it. All right. So again, for the undergrad thing up here, when you put your, just make sure that that's clean. So you were in Dean's list from 11 to 14. I got you. Okay. So that's why up top here, you need to put 2015 for dental school, 2015 to present.
Yes.
Okay. Good. So let's go down to the next section. Work and organization. Again, I want you to bold it and then put it. Work and organization. I think we wanted to call it something different. So two things. Professional organization.
And volunteer experiences.
We want to call it professional organizations. So under professional organization, you've got the Federation of Canadian Dentistry Student Organization, right? And you've got Because Everyone Ability Matters. Those are the two professional organizations that you belong to, correct?
Yes.
Okay. So
So I would take the IWK hospital, put it on next to the education, because those are my externship, what I did.
You can, let's see. So IWK, the two on the first, one on the first page, one on the second page, all of these were your
Externships. Yes.
Gotcha. So what I want you to do under education, under your DDS, when you put your externships, what I want you to do is just list them.
Yes.
Just say pediatric externship, next bullet point, like right here underneath. Pediatric externship, the dates. Under that one, you're going to put, that's the same thing. You're going to put your oral surgery externship, okay? And you're going to put the dates, right? I just want you to list the externships here.
Yes.
And then once we get to that section down here, we'll keep this where you have it right here, and we'll keep that as professional experience.
Okay.
That's the title I want us to use. Professional experience.
Yes.
All right, so let's go back. Let's go back under this second red highlighted work and organization. We're going to change that to professional organizations. Professional organizations.
Okay.
And then where you have A and professional organization, delete that out. I'm going to take out professional organization, and you're going to list this first one.
Yes, professional experiences.
No. Where it says work and organization, I want you to put professional organization.
Yes.
Take out on the next line, the A right here, take that out.
Yeah.
All right. And then you're going to start with this.
Okay.
Now,
Yes.
Keep in mind, like I said, you don't want to have all these different fonts, different font sizes. You got to keep it consistent.
Yes, I understand.
Okay. So this will be the first organization, because the Federation one, and then this one right here, because everyone matters, abilities matter. That would be the second one.
Yes.
All right. And then what you have down here, we'll clean up later. But that's how I would recommend that you do.
Yes.
Section. Then next is you're going to have professional, right where my cursor is, right above IWK, you're going to have professional experience. Professional experience.
Okay.
And then the first one would be this IWK hospital, pediatric, IDK hospital, emergency, Victoria General Hospital, oral surgery, and then Harborview School. That's going to be your professional experience. Any other professional experience that you've had?
One question. So I did in my D3 and D4, my table clinic presentation. Do I have to include that?
I would include it, but not underneath here.
Yeah.
That's a different heading.
Yeah. Okay.
All right. So Harbor School, that'll be your last professional experience. Yes. Then you're gonna have a new, above this volunteer, you're gonna have a new bolded and capitalized heading, which is going to be called presentations. Presentations.
Okay.
Under the presentations is where you're going to list your table clinic.
Okay.
All right. So you need to know where it was done. So if it was at the university, that's fine. You need to actually put the name of the presentation first.
Okay.
The study on the effects of lidocaine on third molar extractions, whatever it is.
Yeah.
Right. Then you're going to put underneath there. You're going to put where you presented it, what the dates were, and if you won any awards or anything like that. Okay.
Do I include the name of the doctor who I did it with?
Yeah, absolutely. Yep. You can. Let's see what it looks like first.
Okay.
Yeah, let's see what it looks like first.
Yeah.
Any other presentations? Are you published?
No. I did a couple CE courses.
Okay, CE courses are not presentations.
Yeah, that's it.
Just want to focus on what you've presented. Any lectures you've given? Are you a tutor or anything like that?
An undergrad.
Okay. No, we want to focus dental school. So that's presentations. Then we can do this. Let's see. Yep. Then we can do this last one, which is volunteer experience. That's what I would call it. Volunteer experience.
Yeah.
Okay, so let's take a look at this again here. All right, so like I said, so volunteer experiences are just, we'll put, volunteer experience. I'm gonna put those down there. When you're listing those, put the ones that are most current first.
Okay.
For example, this one that you have at the bottom, Immigrant Service Association of Nova Scotia, you should put that first because it's happened most currently. Then the next one should be the Kuwait Association for the Care of Children, right here. That should be second. And then this one that's first up here, the Smile one, should be last just because of the dates.
Yes.
All right.
All right.
Again, all under volunteer experiences. And then the last one on your last page here, under professional references. This is perfect. Again, all I want you to do is you got to make that bold.
Yep.
Capitalize. Yeah, capitalize. And you got two people on there. That's great. If you have
these two people are different than the one in the past application, or doesn't matter.
Okay. Now you can include one of the people that are on the pass application. I would.
Okay. So
actually, how many people you have on your pass application?
3, and these 2. So total of 5.
Okay. I would put all the other 3 on there too.
Okay.
The 3 that you have in your pass application, if it's not the same as these 2, put those other 3 on there too. Yep.
All right.
That'll be great.
One question: do I have to mention like the position of the faculty member, or just the phone name?
Yeah, I mean, it'll be good to know if they're a faculty member at the school, or if they're not, they're in private practice, whatever.
Okay.
Yeah, that's helpful. So I would put their name, their title.
Yes.
Let's see, put their name and their degree. Then the second line, like if you look right here under Dr. Mark, you put his name first, and his credentials right after, right? Second line should be if he or she is a faculty member at the school, wherever. Then you put the email and the telephone number.
Okay. Because like the first one, Dr. Nader Hamdan is the program director of the perio program here at Dalhousie.
Yep. So what I would do is the first line is his name. All of these are his credentials. Second line, I would put program director, periodontology, Dalhousie University. Third line, I would put email. Fourth line, I would put phone.
Okay.
And then same format for the next person. Dr. Mark, his credentials.
Yes.
Yada, yada, yada.
Okay.
All right?
All right.
So much better than the last time. Again, I'm so glad that we connected because, like you said, you really didn't have anyone kind of helping you with the format. I'm not sure. Make sure you keep a copy of the first one that you sent me, this copy, right? Make a copy of this one. And then when you do your third draft, let's take a look at that because I want you to see the progression.
Yes, cool. I'll send all 3 progression next time to you.
Yeah, just keep them for yourself and we'll take a look at them. But it's just like a little internal exercise so you can see how you've developed and transformed your CV over the period of time.
Yep.
Okay?
All right.
So good progress, man. Very, very good. Looks totally different than what we started out from over 2 weeks ago, or even earlier than that.
Yeah. Thank you very much.
No, man. Thank you for letting me help you. This is good. This is really, really, really good, man. Okay. So yeah. I know you've got some preparation for exams this week. When is your actual exam?
September 9th, the mannequin exam?
Yes.
Yes, September 9th. I think the patient's CDCA exam is going to be in March. So that should be late in March. So
this is the only exam that you have between now and finishing up your application, correct?
I have the Part 1 NBD.
And when is that exam?
I think it's on the 26th.
Of September?
Yes.
Okay. So we need to set up our next time to talk too. Okay.
Yes.
So we'll do that. So guys, for those of you that are watching, again, if this type of exercise you think would be helpful for you, for me to take a look at your CV and kind of walk you through being able to draft it and clean it up and add and bullet point and accentuate it, hey, I'm here to help. Just send me an email right here at newdentistcoach@gmail.com. And we'll get you in with our coaching program and have me look at your CV. Have a one-time fee for that so we can really just update it, modify it as many times as needed, okay? And I'll be glad to help you. Be sure to check out the next video that's coming up right here, and we'll see you next time. All right, Doc, we'll talk to you soon.
All right.
All right,
Thanks.
Take care. Bye-bye.